The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. One of the nation's most influential doctors, Dr. Marty Makary, professor at Johns Hopkins, warns parents to think twice before getting their child vaccinated. Our conversation is next. Joining us in our newsroom now, we are so happy to have a professor at Johns Hopkins University School of Medicine and best-selling author, Dr. Marty Makary. Welcome.
Great to be with you, Mary.
Oh, well, I understand you are making headlines now saying the U.S. could have better been prepared for the coronavirus pandemic. Why do you say this? Where did we go wrong?
Well, our institutions are supposed to warn us of a pandemic, and we didn't really hear any warning. It was kind of like the closures were like the rapture. You know, everybody was scrambling to find their kids and get groceries. We had good enough information to warn the country, and then we were unable to pivot in telling the country how it spreads. And even the vaccine rollout, a tremendous amount of the vaccine was wasted, given to people already immune and thrown in the trash because the FDA wouldn't allow us to use the extra half dose in the vial. We could have done a lot of things better. And still those lessons can be applied overseas because they're still fighting the pandemic.
And right, those so those, Dr. Makary, how do we, in the terms of deaths and cases, how do we put that in perspective compared to other countries? Where do we fall in terms of that?
One of the things we have not talked about that we need to talk about was the role of obesity and overweight in the case fatality rate. It's one of the reasons why the U.S. had one of the highest deaths per population rates in the world. 78% of all COVID hospitalizations were in people overweight and obese. There was some political correctness where we couldn't fat shame and bring it out. There was also really bad data coming out of the CDC. We needed better risk stratification. And even today, it turns out the risk in healthy kids versus a kid with a comorbidity is diametrically different. It's entirely different. And it changes that decision for parents in trying to figure out whether or not they should have it done for their kids.
That's incredible. I mean, I know obesity is a risk factor for everything. I mean, that's another issue that maybe we could talk about at some time. And like, we need to be careful in how we say those things, but it's not about body shaming or body image. It's about really, this is a condition that can be prevented. So the UK, for example, Dr. Makary, beat the US to herd immunity, as I understand. They focused on the first doses and sort of waited to just get at least a dose out and have some protection against the virus, delaying the second doses, which saved lives. It was an experiment. It wasn't based on evidence, but clearly there's a difference between the FDA and EMU. So safety first, of course, we need to build evidence, but there's such thing as science based on projection. So why didn't we do that? And what are your thoughts on that?
Well, the UK went the correct route, Mary, and they saved many more lives because of their focus on first dose strategy. Many of us were saying from our clinical wisdom, look, one dose is better than none. And we got evidence early on in December that the efficacy of the first dose at 4 weeks was as high as 92%. That was in the New England Journal of Medicine. So many of us said, let's focus on first doses and delay that second dose to 3 months while we're supply constrained. We should have done that. And today, around the world, they need to do that. I was talking with doctors today in Africa. They're also supply constrained. They've got less than 1% of the population vaccinated. They should learn these strategies because they've been proven to be effective.
And I also understand that I was speaking to a pharmacist and even pooling the vaccines at a little tiny bit left that you could put together would be a strategy to think about. And I don't know if anybody is doing that or maybe that question should be raised. And then you did this yourself, or sort of the science based on projection. And I don't want to put words in your mouth, but when you called for universal masking before the pandemic, how did you know?
Yeah.
How did you know to call for that?
So look, it turns out that SARS-CoV-2, which is COVID-19, spreads exactly like SARS-CoV-1, which was SARS in 2003, and exactly like MERS, which is the other hot coronavirus. So it really was not the riddle of the Sphinx, trying to figure out how is this thing transmitted, it's identical to the other sister virus. And so when listening to the Asian doctors, and by the way, they were urging us to wear masks early when they saw what was happening there. We were sort of stubborn. We wanted elaborate studies done. Our old guard medical establishment sort of dismissed it quickly. And when I wrote that first piece last spring at the beginning of the pandemic calling for universal masking, I took a lot of heat for that article, but I really do believe in masks. As a surgeon, I don't think anyone wants me operating on them without a mask on.
Mm-hmm. Well, you know what? I mean, it takes a lot of strength to speak, sort of your truth to power. So I think it was worth the backlash, of course. But you say Dr. Fauci failed the American people in the approach to the pandemic. And have you spoken to him directly about this? And why are you saying this?
I have spoken to Tony. He's had a bad week, as you know, last week.
Yeah.
And Tony comes from a different perspective. And I told him I respect that. I respect his service to this country. I believe he wants the best and he has the best intentions in mind. He's just coming from a very different opinion. And we used to have an open discussion of different medical opinions, but now it's like totalitarian. It's as if there's one major opinion and everyone has to fall in line. That's not good for science. It's not good for public health.
No, it's definitely not. Wow. Okay. And then I understand you have a new book out. Okay, tell us about this book and where can we find it?
I'm really excited about this new paperback book. It looks back on COVID. It's called The Price We Pay. And it really looks at not just the COVID and where we went wrong, but also how we have to redesign care. It's not a piece of legislation that's going to fix healthcare. It's actually a revolution taking place. It's treating more people with diabetes with cooking classes than just throwing insulin at them, and treating more back pain with ice and physical therapy than just surgery and opioids. We're starting to see now research on the underlying environmental causes of cancer, the environmental exposures, not just chemotherapy. Food is medicine, and we're seeing a revolution now to recognize that we cannot be addressing health in quick 10-minute visits. Doctors hate it, patients hate it. So there's a revolution to redesign care. And the other part of the book is the pricing failures in healthcare. That is being disrupted right now through new marketplaces, and it's healthy because price gouging and predatory billing have unfortunately become a commonplace business model in healthcare today, and it threatens the great public trust in our great profession in medicine.
Public trust is key, right? I think that was the number one reason why people are hesitant to get the vaccine at some point, because of the ongoing back and forth between the media, what's going on and people's messages. Yeah. While I have you on, Dr. Makary, what is your theory, or what is your thought? What are your thoughts on the Wuhan lab leak and the origins of the coronavirus?
Well, Mary, it was very clear to me early on that there was an infected lab worker who went to the local hospital. First of all, if you go on Google Maps, they're about 5 miles apart. That's pretty much 90% of the evidence you need right there when you're talking about the source of a global pandemic. It's one of the few places manipulating bat coronaviruses. We should have never been funding that research, and they should have never been doing it. We don't need to characterize the viruses in nature. We'll just, once they cross over into humans, we can sequence that DNA and characterize it in 45 minutes with new sequencing technology. There's 1 million viruses in the world. Do not mess with Mother Nature. So I said on Fox last April of the beginning of the pandemic that there was an infected lab worker that was likely patient 0 that went to that local hospital. We know the doctors were detained. We know that the papers that have come out from that research have shown that they've done gain-of-function research and cited the NIH funding for it. And if you look at the cover-up, it's really one of the worst cover-ups in the history of cover-ups. None of the samples have been turned over, no lab records, nothing. And so we can demand a full investigation, and that's what politicians do. They grandstand and posture, but we're not going to get any more information. Right now, it is no longer the lab leak hypothesis. It is the default conclusion of overwhelming circumstantial evidence.
That is incredible, and just the way in which the gain of function research works, right? Don't mess with Mother Nature. I liked how you put that. Any other thoughts that you have? Anything else that you'd like to say? Your message.
Just like in politics, there's Republicans and Democrats. In virology science, there are pro and anti gain-of-function research advocates. And many of us have been critical of gain-of-function research. Matter of fact, some doctors, colleagues of mine at Johns Hopkins, put out a big statement years ago saying we should never do this. Turns out now that's a big lesson we should learn. And in terms of everyday lives now for everyday Americans, live your life. If you're immune, live your life. One of the greatest failures of our medical leadership has been ignoring natural immunity from prior infection. It's real. It works. The data are there. I summarized it in the Wall Street Journal last week. And so if you haven't had the infection and you don't have natural immunity and you're not vaccinated, you need to be careful. And by the way, you're out there at your own risk. Society can't stay closed waiting for you. If you've been immunized either by vaccination or natural immunity, live your normal life. We've got to reestablish the human connection in communities right now. And we can't be mandating the vaccine. It doesn't make sense with kids. There's still some complications that haven't been characterized after the second dose. For people under 30, I recommend one dose until the CDC sorts out the complications of heart inflammation.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.